The high cost of health care, weakening economy, and loss of health insurance is leaving millions of Americans in vulnerable situations. Incredibly, there are millions of Americans living without health coverage. Many of them are right here in San Diego. That's why so many believe the healthcare system needs a major overhaul. Healthcare is becoming more expensive, premiums continue to rise, and many Americans feel they can't afford health coverage.
Today, healthcare is so expensive.
The doctor's bill and the emergency services bill, and I'm just like, it's overwhelming.
The way we have built healthcare in this country, it's a business rather than a service.
There are 47 million people in America today. They just do not have the income to pay for the health insurance.
And I'm very impressed with community clinics. Thank God for them.
Tonight, we take an in-depth look at one of San Diego's largest community clinics. The San Ysidro Health Center Network allowed us to look at the challenges and struggles San Diego families face when it comes to the high cost of health care. As the debate over healthcare reform intensifies in Washington, millions of Americans are experiencing financial hardship as a result of serious medical conditions. There have been many proposals for universal health coverage, but nothing's changed. Many feel the system is broken, but few agree on a solution. There are currently up to 4 healthcare reform bills before the House of Representatives. If approved, would create affordable healthcare for the uninsured, give patients access to medical services, high quality, comprehensive, and continual care. Ed Martinez says community health centers like San Ysidro represent the platform for implementing universal health coverage.
We've always been located in medically underserved areas. All our providers provide primary care that emphasizes a medical home, that emphasize wellness and healthy lifestyles. For those reasons, we're in a perfect situation to implement all the healthcare reforms that are now being debated in Congress.
Community clinics have typically been recognized for treating the underserved, low-income populations. Dr. Bob Ross from the California Endowment in Los Angeles believes health centers are becoming the safety net provider for millions of patients across the country and in California.
I think community health centers started out as a Band-Aid. They started out as a response to a system that was dysfunctional and broken. I think they've moved from a Band-Aid as the metaphor to a model of what integrated community-based health delivery can provide.
Community clinics are evolving and growing into multi-million-dollar medical facilities which can better treat more patients. UCLA professor of medicine Dr. David Hayes Bautista was part of the community clinics movement during the 1970s. Now those same clinics are celebrating 40 years of service across the country.
And community clinics from their very inception have had a focus on prevention as one of their primary goals in a community. So it's not just enough to patch people up, provide services. Let's see if we can prevent things from happening, physical things, mental things, dietary things, etc.
Community health centers play a vital, critical role, and that role is increasing in importance, I would argue, over the years. They started out as pretty much free health clinics, community-free clinics, and that mission was to serve underserved, marginalized, low-income populations that were uninsured.
Locally, community clinics like San Ysidro Health Center Network treat up to 1,000 patients daily in San Diego, National City, Chula Vista, and San Ysidro at 23 different sites, and they offer a sliding fee program to patients without insurance. Congressman Bob Filner knows the South County population is primarily Latino, Filipino, and some African American. These groups face serious medical challenges like hypertension, heart disease, diabetes, among other potentially deadly illnesses. which means patients in these groups and region are at a greater need for health care.
And these community clinics filled a desperate need. Since then, they have become bigger and more professional and more huge and get federal grants. And they have become the place of most confidence in the community because it's part of the community.